Prepare your brain for an imminent upload, because news, analysis, and opinion is on the launch pad.
I love that you offer different opinions.
Great topic, so positive.
Strap in for the truth warrior and woke destroyer. This is the Randy Tobler Show.
Even we're not sure what's about to happen.
Now, here's Randy Tobler.
Doctor, give me the news. I got a bad case of loving you. No pill's gonna kill me.
Hey, welcome. It's time for the Doctor's In segment. We do this every Friday about this time, and sometimes we talk about medical issues that you may be suffering from, whether it's a bump here or a scratch there or a cough or whatever. But there's a lot of bumps, scratches, and coughs in your medical finances as well, and often that causes as much or more pain than the disease itself, or avoiding a disease or itself. And to help us with some of the medical financial bumps and bruises is Paul Seegert, managing partner at PCS Advisors, at PCS Advisors on Twitter. How you doing, Paul? Thanks for talking with me.
I'm great. How are you today?
I'm good, but I think for all the veterans out there and all those who are currently active service members who will be veterans, and all those who know or live with or have a relative as a veteran, which probably applies to 90% of the audience, there's some concerning things about what otherwise I think on the surface looks like a pretty good bill, the GOP debt ceiling bill, tied to some fiscal restraint. But there may be a little wrinkle in there that could affect the VA and its beneficiaries. Can you help us unpack it?
Sure. Part of the problem is that if we do have shutdown, then the government can't pay its bills, certain bills, and that would affect veterans. It would affect Medicare. It would affect Medicaid. So what we have seen in the past is that they may stop making payments to those programs or stop making payments to the providers who provide services for the people that are in those programs. And if it goes on too long, then the providers might say, hey, we can't provide services. Now with the VA, a lot of them are going to VA facilities, but if they reduce funding, they may have to limit services. So it'll have likely quick impacts on veteran care.
Yeah. And the Democrats on how the funding restraint in the bill that's cooked in the bill that, of course, Joe Biden doesn't want to talk about. He doesn't want to connect the two. That there may be, according to PolitiFact, there might be some risk that there could be a big cut in fiscal year 2024 compared with this fiscal year, due to is that a particular provision that's just a blind spot in the bill, or is this just a casualty across the board? Not really cuts, but cut in the increase is what they call cuts.
I think casualty across the board. What happens is they go back to this pre-pandemic level of spending, which would be an 8% decrease, which is a big number when you look at the amount of dollars that are spent on this. Yeah.
Huh. And in a related story, more and more people are signing up for the Medicare Advantage programs, and that impacts, those are being gobbled up like cookies by the Cookie Monster, by these big companies that are vertically integrated that are owning more and more doctors' practices, right? How does that work?
Well, somehow we won't allow two budget airlines to merge in this country because we don't want airfare to get too high, even though I just bought a $28 ticket to Fort Lauderdale. but we'll allow United Healthcare and Optum to become one company. We'll allow CVS Caremark and Aetna to become one company, which were three separate companies. We'll allow Cigna and Express Scripts to become one company, and under the guise that it will add efficiency and lower costs for consumers, when in fact consistently this kind of consolidation, these healthcare conglomerates have created they've consolidated power and increased prices. Mm-hmm. So we have put 100 million Americans in medical debt because we've allowed this kind of thing to occur, and most of them have insurance.
And I think we should say, too, that it's not only a cost side of the equation that is pinching people in this because of the medical inflation that's invoked through this integration, where there's a perverse incentive when the doctor sees you and the doctor's employed by a company and the doctor is bound by contract to send, unless there's a compelling medical reason not to send, to at least advise you to go to the company-owned ancillary service, whether it's a pharmacy or some other provider. But what about their under the name of proper utilization of resources, what amounts to just rationing of services by a doctor who's never seen the patient? They do a lot of that.
Well, absolutely. You have right now, if you look at Cigna as an example, they can deny hundreds of thousands of claims, and a doctor is supposed to look at a claim to deny it, and they're spending an average of, I think it's 1.2 seconds per claim. So are they really looking at it, looking at the information that was sent to them and making a decision, or is it what's really happening is they're batching a bunch of claims and denying them? And I mean, it's not just, certainly in the gray area, it's not following the rules as they were meant to be, or as they were intended.
Well, I have heard people in the hospital billing and financial side of things in the industry say that they believe that there is systematic, just widespread denial of claims just to dare offices to try to recover.
They do, because they know that the percentage, it's all, it's spreadsheet driven, math driven. When you know that only 5 or 6% are going to go through the effort to push back and go through the process, that's kind of how the algorithm is built. They target claims that are worth a certain dollar amount that they know for the provider to fight back, for the member to fight back, it's going to be, let's say, $300, and the claim itself is only $600. So they're going to just wash their hands of it.
Yeah.
So the doctor will look at a claim that's $37,000 at the insurer, and on the other end, the provider, and they all work through it and get it approved or not. But they're very smart in how they evaluate which ones to put into this program where they batch them and deny them.
So we're talking about...
It's actually a former pediatrician that built that system for United, for a couple of the big insurers out there. And by his own estimates, he has saved the system billions of dollars. And I don't know if saved is the right word.
Yeah, no, he's earned the profligate profits for these companies. We're talking with Paul Seegert, managing partner at PCS Advisors, a benefits management consulting firm. They do a fabulous job, and I know, Paul, you and I have talked about the model that we think that people need to go to, and I know you're an advocate of that. Is this potentially an opportunity, even though people might perceive it as pain, if there were a debt ceiling crisis and a healthcare system meltdown, at least partly, depending on how you're insured and so forth, would this be an opportunity for people to just maybe get that nudge that they need to get off of the perch that they know doesn't feel real good and isn't real stable, and try a different model, more direct to the provider of the care kind of a model? Could it work for some people who may be at risk should the debt ceiling thing result in a healthcare meltdown?
Well, it definitely could work for some people, and hopefully that's a positive outcome that we would see, that people would reconsider how we're funding our consumption of healthcare. Yeah. Health insurance has become, look at our report card for the last 13 years, which is the Affordable Care Act era of healthcare, as I call it. Deductibles have grown 87%, premiums more than that, and we put 100 million Americans in medical debt. Most of them have insurance. If you have insurance and you're going into debt for healthcare expenses, are you really insured? Yeah. We have a huge portion of this population that's functionally uninsured, and there are better ways to fund your consumption of healthcare.
Yeah. Well, and if the same kind of a scenario applied to cars and homes, people would be up in arms, right? But somehow there's been this creeping cost shifting to patients rather than their insurance. Whereas if that happened if a deer hit your car and you had a $500 deductible and they said, well, we're not going to cover it, or now next year your deductible is $5,000, but you're still going to have to pay $300 every 6 months or whatever you're paying. People would be up in arms, wouldn't they? But that's exactly what's happening in healthcare.
That is, yep. We have 2 out of 3 bankruptcies are still the result of medical bills. Most of them have insurance. And that, to me, is one of the most ridiculous truths in this country. When you have the biggest economy in the world, a fifth of our economy is spent on healthcare, and we're putting a third of the population, roughly a third, into debt.
Yeah.
It's on their healthcare expenses. And here's what's to me even more insidious. You've got, let's say you want to go get a CT scan. If you walked in there and said, I'll pay cash, price average nationally, it's somewhere around $287. If you were to say, let me pull out my insurance card, they're going to bill your insurance thousands of dollars. What kind of sense does that make?
You're right.
You don't have to be an insurance expert to say that's silly.
No, I think anyone who's involved in and the patient, I'm so tired of seeing patients suffer and struggle with, on top of whatever illness, or whether it's diagnosed or yet to be diagnosed. It just breaks your heart as a clinician. It breaks my heart to see people really struggling, sometimes rationing. I don't really want to get that test. And on the other hand, the people that are trying to provide care, people of integrity, that are just trying to keep afloat with all of the regulatory environment and now the hammering they're taking from whether it's a federal or a commercial insurer. And the patient just continually gets caught in the middle. It's just awful. And the only way I can see to do it is do the Mr. Pillow gambit, right? Just go direct to the consumer. And I think consumers prefer that. So. Yeah. You're seeing that with more and more industries.
We did that.
Yeah.
Yeah, we did that with our own company. We built a nice business, and I was on our employee health plan along with all the employees, and I have 5 kids and a good-sized family. And for a really high deductible, pretty junky plan, a bronze type plan, I was paying $20,000 a year in premium. That is really silly when you think about what does the average person make and how much of their income is that taking up. And I know a lot of employees don't realize how much the company's paying for their benefits. And I think there's a disconnect there that we should resolve. Yeah. It should be made very public. That's robbing from your wages, really. And we made a decision as a company to go a different direction. Now we are healthcare consultants. It's what we do every day, but we put in a direct primary care program where our employees could have a direct relationship with their primary care doctor, and the primary care doctor could actually operate independently of any big system. They weren't a salesperson that had to shuffle people to the specialties to make money. They could give them actual primary care. And then we put in a medical cost sharing program as a kind of a stop loss against big claims. And our costs went down to 40% of what they were before as a company and as individuals. My son, I have 5 kids, I mentioned. My oldest son broke his arm. Everybody has, well, all the people I know with big families, one of the kids is not as coordinated as the rest. This is the one. He's broken his arm twice. And he's had now a couple of surgeries and quite a lot of care for this arm. Over $20,000 of care on this arm in the last 6 months. I have paid $750 out of my pocket.
Yeah.
And while on a monthly basis, when everything's okay, I am paying 40% of what I used to pay in premium. I pay way less out of pocket. I have better care. He knows his doctor. I know his doctor. This is how healthcare used to be. If we bring it back, I think not only could we save healthcare in this country, we could save the whole country, the whole economy.
Yep. I mean, it would be a game changer. It'd be a game changer. Yeah. And I call you. You're like the Apostle Paul, who used to be on the wrong side of the Christian message, right? Before he converted, because you were purveying the traditional healthcare model or healthcare insurance model, and you couldn't. And I've found that I can't be a part of it either way. And as you know, I'm launching my own practice that is that kind of a thing, because I just cannot be beholden primarily to the machine. I got to be beholden to the patient. And more docs are realizing that, and patients are liking it too. So, well, we'll continue to beat that drum. And I know employers can, if they're interested in that, can get in touch with you too, and potentially, take a look at different ways of funding their insurance too, because it's a win-win in very many cases. Not all. And, it just takes an analysis. So thanks for helping us out with this. I sure hope that people don't get caught in some kind of a debt crisis crunch. But if they do, maybe it's an opportunity at least for them to maybe just sort of like pulling the plug on the dish or the cable and looking at something else. Yeah.
I think so, too.
All right. Hey, Paul, thanks so very, very much. Tell your wife to have a happy Mother's Day. I hope you're going to cook her breakfast in bed, or the kids will.
Well, somebody at the country club is.
Okay. All righty. All right. We'll talk to you later. Thanks, buddy. Appreciate it.
All right. Have a good day.
All righty. Paul Seegert. There is a better way. That's a great way to look at things. There's a guy who used to be in the old system in terms of his business, and he said, no, I'm switching to the new way.